Staff Nurse CVT Exam Preparation Part 3. Question number 13. Which infection is most commonly screened for during the first trimester? Here, right option is all of above. That means hepatitis B, HIV and rubella. Next question. What is the term for excessive vomiting during pregnancy? Here, right option is hyperemesis gravidum. Next question. Where is the fundal height measured from? Right option is option A, symphysis pubis to top of uterus. Next question. How often should fetal movement be felt in the third trimester? Right option is option C, 10 movements per 2 hours. Next question. Which test confirms pregnancy earliest? Right option is option B, serum HCG, human chorionic gonadotropin hormone. Next question. What is the most common cause of postpartum hemorrhage? Here right option is option B, uterine rupture. Next question. When does implantation of the fertilized ovum occur? Right option is option B, 5 to 6 days after fertilization. Next question. Which structure produces progesterone in early pregnancy? Right option is option C, corpus luteum. Next question. What is the term for the first menstrual period? Right option is option C, menarche. Next question. Which contraceptive method is permanent for females? Right option is option C, ट्यूबेक्टोमी. एंड अगर पूछेगा कि मेल्स में कौन सा कॉन्ट्रासेप्टिव यूज होगा, देन कॉल्ड इज वेसेक्टोमी. नेक्स्ट क्वेश्चन. When is RH immunoglobulin given to an RH negative mother? Here right option is option C, at 28 weeks and after delivery. Next question. How is eclampsia different from preeclampsia? Right option is presence of convulsions. Next question. What is the common site of ectopic pregnancy? Right option is option D, fallopian tube. Question number 26. Which fetal presentation is considered normal? Right option is option C, vertex. Next question. When should breastfeeding be initiated after birth? Right answer is option A, within 1 hour. Next question. Which pelvic type is most favorable for vaginal delivery? Right option is option D, gynecoid. Next question. What is the normal pH of vaginal secretion? Right option is option B, 3.5 to 4.5. Next question. Where is the embryo implanted into a normal pregnancy? Right option is option D, uterine endometrium. Next question. What is the most common cause of maternal death globally? Right option is option B, hemorrhage. Question number 32. Which hormone help in the softening of pelvis ligament during pregnancy? Right option is option A, relaxin. Question number 33. What is the ideal birth spacing between two pregnancies? Right option is option C, 2 years. Next question. Which part of the fetus is used to assist the lie of the baby? Right option is option B, back. Next question. What is colostrum? Right option is option C, first milk after delivery. Next question, which instrument is used to measure cervical dilation? Right option is option D, fingers. Next question, what is the best indicator of fetal well-being? Right option is option C, heart rate. Next question, what is lochia? Right option is option C, vaginal discharge after delivery. Next question, how long does lochia typically last? Right option is option D, 4 to 6 weeks. Next question, what is the common cause of infertility in females? Option B, PCOS is right option. Next question, which hormone stimulates milk production? Here, right option is option D, prolactin. Next question, what is the normal blood loss during vaginal delivery? Right option is option D, up to 500 ml. Next question, when does the embryonic period end? Here, right option is option B, 8 weeks. Next question, what is the most common type of gynecological cancer? Here, right option is option B, cervical. Next question, what is the normal duration of the menstrual cycle? Here, right option is option B, 25 to 30 days. Next question, what is the cause of Down syndrome? Right option is option B, trisomy 21. Next question, what is the average weight gain in a healthy pregnancy? Right option is option G, 11 to 16 kg. Next question, which sign is considered presumptive of pregnancy? Here, right option is option A, amenorrhea. Question number 50, when should iron supplement be started during pregnancy? Here, right option is option C, second trimester. Question number 51, what is quickening? Here, right option is option B, first fetal movement felt by mother. Question number 52, what is the most common position of the uterus? Here, right option is option B, anteverted. Next question, how is cervical cancer best prevented? Here, right option is pap smear and HPV vaccine. Next question, what is the most common symptom of uterine fibroid? Here, right option is option B, bleeding. Next question, when the best time of breast self-examination? Here, right option is option B, 1 week after menstruation. Next question, which hormone is measured in pregnancy test? Here, right option is option C, HCG hormone. Next question, what is the function of the placenta? Here, right option is all of above. Next question, where does fertilization usually occur? Here, right option is ampulla of fallopian tube, option number D. Next question, which is a contraindication for vaginal delivery? Here, right option is option A, cephalopelvic disproportion. Next question, what is the most reliable sign of pregnancy? Right option is option C, fetal heartbeat.